This is Joe Pratt. It's January 25th, 2021, and today we're doing a ABC podcast on Relief Therapeutics. The NASDAQ clearing symbol is RLFTF. We're doing this because we believe that before February 1st, RLFTF is going to bring out top-line data on their drug which addresses acute respiratory syndrome in COVID patients. Obviously, we've had approximately 450,000 COVID patients die, and the usual cause is acute respiratory syndrome. This is a Swiss company with a market cap of $1.5 billion. It is 1/3 of the stock is owned by Gem Capital. They recently signed an agreement with the company to buy stock at market levels to fund the company's growth capital needs. The company also has a clinical trial joint venture with NeuroRx, which is an Israeli headquartered company with domestic operations in the United States in Wilmington, Delaware. And recently, a SPAC, Big Rock, has announced a merger activity that they're going to carry out with NeuroRx. The trial, this drug has been in trial since July 2020. Its formal name was Avipidil, and recently they changed it to Zysami. It's been in clinical trials, as I said, since July 2020. There have been 2 or 3 preliminary clinical trial announcements that generally showed that in a 28-day period, these patients with acute respiratory syndrome recovered to the tune of 70 or 80% of the patients versus about 20% for the control patients. Now, the trial is known as NCT 043-11697. There are approximately 250 patients in the trial. And any day now, between now and the end of January, I expect the top-line data from this trial to be announced. If the data is strong, and strong enough for the market to believe that the drug can receive FDA approval, it would seem to me that the market cap could rise substantially above $1.5 billion, given the revenue potential. If COVID were to suddenly die out and there wouldn't be this need, there are in the United States 250,000 acute respiratory syndrome cases per year, so there's demand amongst that group. The drug is a synthetic human vasoactive intestinal peptide, which was actually invented long ago at Stony Brook on Long Island and forgotten, and the company discovered it in 2020 for use in COVID-19. If you have any questions, please give me a call. Again, this is Joe Pratt. My email is jhpratt@alphavestcapital.com. If you'd like to talk to me about it because you have some specific information that you've done as a result of your own research, give me a call at 610-517-4445. Thank you very much.